watching our TV. Today we are joined by Ayden Jacob, who received his AA and BS in Biology, Neuroscience and Philosophy and completed neuroimaging fellowships at the University of Pennsylvania. Hi Benjamin, thank you for talking to us today.
My pleasure.
So today's topic is brain treatments. Which therapies are used to treat brain tumors?
Typically, a neurosurgeon will evaluate the location of the tumor, the size of the tumor, and perhaps even with the help of mathematical radiation oncologists, the exponential growth of the tumor size over time. Based on this, an interdisciplinary team of radiologists, radiation oncologists, and neurosurgeons act together and determine the best route. The three most common routes to treat a brain tumor are: 1, resection of the tumor via a surgical procedure, which means removing the tumor from the brain via surgery. 2 is treating the tumor with drugs via chemotherapy by a medical oncologist. Or 3, treating the tumor with radiation therapy laser beams in order to shrink the tumor size. In many situations when the tumor is aggressive, the interdisciplinary team of oncologists and surgeons will work together, and they will do all three over a period of time to combat the tumor.
How is surgery used to treat brain tumors?
Surgical procedure to treat brain tumors differs based on the type of tumor and the location of the tumor. I would say that the most fascinating and perhaps technologically advanced tumor which is resected via surgical procedure is the tumors of the pituitary gland. This is specifically because the new age of technology is using an endoscope in order to enter the brain without ever cutting the brain open. That allows patients to leave the hospital earlier and have less complications for infections, etc. The way this works is that the neurosurgeon navigates through the patient's nose up to the base membrane of the brain and then is directed exactly with a camera to the base of the pituitary gland where the tumor sits. And without ever opening the skull of the patient, the neurosurgeon is able to cut out the tumor and bring it and drain it through the patient's nose. And after a very short procedure, the patient is awake, feels fine, and can go home within a few days.
What is radiation therapy?
Radiation therapy is the utilization of different types of high energy beams, whether they are electron, proton, or photon beams, in order to attack the cancer cells within the brain. The advantage of using radiation therapy is that A, you never have to open the patient's brain, and B, the patient doesn't have to undergo chemotherapy, which many of the chemotherapeutic agents we use have bad side effects. So by using radiation therapy to treat brain tumors, which is simply the utilization of laser beams, more or less, to treat brain tumors, we can begin to kill the cancer cells within the brain without intervening in the bloodstream, the neuropharmacology of the brain, or the actual brain matter via surgery.
What is stereotactic radiosurgery?
So the difficulty which comes out from using radiosurgery in treating patients with brain tumors is that we have to visualize the brain in a 3D matter, and we have to understand that the tumor is located in a very specific point in the brain. And on top of that, the matter, the brain tissue surrounding the tumor is extremely delicate and cannot be touched by the impending laser beam. Because if the laser beam comes in and it attacks the brain tissue, which is healthy, that can cause damage to the patient. So in order to circumvent this problem, biomedical engineers, neuroscientists, brain surgeons, and the like have developed a way to map out the brain in a 3D image and thereby mapping out to the millimeter the three-dimensional analysis of the tumor within the brain. This map of the brain is then given over to the radiosurgeon and the neurosurgeon, whereby they can then implement the radiation oncology into the brain to specifically only attack the tumor and nothing else within the brain. So it's simply a map of the brain which allows us to attack the cancer cells and nothing else around it.
Many thanks to Benjamin Jacob Hayam-Poor for talking to us today at Astronaut TV.
My pleasure.